ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello and welcome to this podcast. My name is Catherine and I am your host for today's episode of ECDC On Air. This is the podcast of the European Centre for Disease Prevention and Control, which is recorded from our headquarters in Stockholm, Sweden. In this episode, we are going to talk about how ECDC uses statistics in public health and surveillance. What are these statistics, how they are used, how and why ECDC works with them. These are the topics of our discussion today. With us today, we have Joana Gomes Dias, expert in biostatistics at ECDC. Good morning, Joana.
Thank you, Catherine. Good morning, and thank you for having me here.
First, I would like to ask you to tell us more about yourself. What is your background?
I'm from Porto, the second largest city in Portugal, and I've been working as a statistician in epidemiology and public health in the last 16 years. Regarding my background, I got my first degree in math and then a specialization in statistics and modeling. During that, I was fascinated by its applications to health data, and I was working at the public health department of the northern region of Portugal in various health programs. Working with public health professionals and epidemiologists, soon I realized that I was missing an important piece. That was the knowledge in epidemiology. So I started my studies in epidemiology as well. From my studies, I gathered the knowledge and the skills to be able to apply statistical methods in health.
So if I understand well, you started with mathematics and then statistics. And then you added a piece, which is health. That leads me to my second question. What brought you to ECDC and what do you do?
In the last 16 years, I had the privilege to know by seeing and by experience the reality of public health interventions in practice, both at regional level, national level, and in the last 11 years at EU level. When working at the public health department in Portugal, I had my first contact with ECDC. So we followed very close ECDC outputs and recommendations, namely technical guidance and the following the epidemiological situation of the various infectious disease. So I was very curious and eager to apply the knowledge on statistical methods to surveillance data instead of regional level to European level. So how it is to use all this data that we gather at ECDC from all European countries.
So now we are going to talk about statistics in public health and surveillance. What do you do at ECDC?
ECDC collects routinely data on more than 50 health issues at the European level. We analyze data using statistical methods to understand the distribution of the disease across Europe.
So what does the term statistics mean?
So statistics is a branch of mathematics dealing with the collection, analysis, interpretation, and presentation of data.
And what are biostatistics now?
So biostatistics is the application of statistical methods and techniques to biological data, especially data related to human biology, such as health and medicine, and the development of new tools that allow us to study these areas in more detail.
Could you give us an example?
We have, for example, a very recent study that was published and performed during the pandemic that studied the association between age, underlying conditions such as asthma, diabetes, cancer, and severe outcomes among COVID cases. And the outcomes, so we consider as hospitalization and death among the COVID cases.
Who requested those statistics or this study? Was it from inside in ECDC or was it a request from the Commission or from the Member States?
The requests at ECDC can come from the European Commission, from the member states or from the disease expert working in the different disease programs. In this case, this was a collaborative work of a team of experts. With this study, we aim to measure the strengths of the association between underlying conditions and severe outcome among COVID-19 patients in different age groups. The main objectives were to estimate the risk, both relative and absolute, of individuals with underlying conditions on hospitalizations and death.
How the member states or how the authorities are going to use this study?
So this study aims to support decision-making regarding which groups should be prioritized for vaccination.
Which data were used in this study?
So we use data submitted by member states to the European surveillance systems between June and December 2020, the first year of the pandemic. And in this study, we include data for a subset of countries. Only 9 countries were included. So member states report data both at aggregated level or case-based level. And for this study, we need case-based level data. And this is important because we want to measure at the individual level both the presence of underlying conditions, the age, gender, and the outcome. So what is the outcome of this case? Was this case hospitalized? Did this case die? So we need to understand, so this is important why we have case-based data.
Of course, these data are anonymous.
Yes, and ECDC has data protection policy in place.
What do you do with this data? Do you have a methodology? How do you apply these methods and how does it work?
First of all, as you mentioned, any study that we perform, we should start describing our data. So understanding if the data is comparable, if the data is representative, if we have the information that we need at the different variables. So do we have enough data to perform this study? So these are all a set of example questions that we need to think about when we start performing the study. So then when we think about that we are good, so we then move to the method. And for example, in this case, we have used a statistic technique called logistic regression. And this technique allows us to identify which variables have an impact on the outcome, which of them are the most important for the outcomes that we are studying.
So, logistic regression, I would like to go back to this expression. What does it mean exactly?
So in statistics, when we want to quantify the association or to estimate the effect of a certain exposure, and in this case, for exposure, we can understand any factor that can play a role, such as vaccination, age, or any kind of environmental hazard, so the presence of a mosquito, and its association with an outcome, so getting the disease, getting hospitalized.
Can you tell us what exposure is?
Yes, Catherine. So, for example, exposure, you can think of any factor such as age, gender, or any kind of preconditions such as asthma, diabetes, or cancer.
What logistic regression models are applied?
In statistics, when we want to quantify an association or estimate the effect of an exposure in an outcome, we use a technique called regression in general. And there are different types of regression. And in this case, as our outcome is dichotomous, meaning that death or alive, hospitalized or non-hospitalized, we need to use logistic regression. And moreover, we use what is called multivariable models because we are aware that some variables have a high influence in our analysis, such as age and gender, and they may influence the associations, and this influence may be due to confounding or to effect modifiers, so they can change the way that we look to the associations.
And then once you have applied this model of logistic regression, what kind of output do you get concretely?
We get a measure that it's called odds ratio, and it measures the association between the exposure, the variables and the risk factors that we are studying, and the outcome. And it measures the strength and the direction.
Do you have all this data in your database at ECDC?
In this particular study, we use data that it's collected by ECDC and submitted by member states. But for other studies, we may need other data sources.
Like data linked to climate or?
Yes, like climate data, like traveling data from IATA.
What was the output of this work? Was it a report, a study?
It was a study and it was published in the scientific journal Eurosurveillance.
How do the member states use these statistics or this report? Do they use it when they make decisions?
Yes, so these studies show that several underlying conditions are associated with severe outcomes among COVID-19 cases. And it really highlights the importance of accounting for specific age cutoffs for individual underlying conditions, mainly for COVID vaccine prioritization.
As a European citizen, how do I benefit from this work? Does it have an impact on my life?
As a citizen, you may have certain characteristics and then you may belong to one of those risk groups. So, of course, you will benefit if the vaccination policy targets these priority groups, not only based on age, but also on its combination with existing underlying conditions. So, based on evidence and scientific studies, we aim to support policy for public health action.
What is ECDC added value in analyzing those data and producing statistics?
All this data is useful to understand what has happened, why it happened, and to predict what can happen. And this is crucial for supporting public health, policy, and decision making. So the better we understand the occurrence of infectious diseases, the better we can plan the public health interventions that will work and have an impact to improve health in the European population.
This podcast is coming to its end. Thank you very much, Joana, for this interesting conversation. It's not easy to understand the figures, the data, how they interlink with each other, and it was really an easy explanation.
Thanks, Katerina, for hosting me, and it was a pleasure to be here.
We hope you enjoy listening to this podcast about statistics in public health. If you would like to know more, please visit our website ecdc.europa.eu or follow us for the latest news on social media.